hubiera gustado ponerle música, mariachi, pero lo dejaremos para posteriores, pero sí no queremos perder la oportunidad de felicitarla. Y pues estamos muy felices. Y el día de hoy vamos a ver un tema muy, muy relevante, que es el relacionado con la palabra muy larga y complicada, sustainability, sustentabilidad, sostenibilidad. Aquí tenemos un problema de traducción. Si unos dicen sustentabilidad, otros sostenibilidad. Creo que va más sustentabilidad y que se está manejando mucho en gobierno, en políticas. Y pues, sin más preámbulos, son las 9:06 de la mañana de este sábado 5 de junio y le voy a dejar la voz y la presentación a la doctora Rebeca Lee. Adelante, doctora Rebeca Lee, es toda su audiencia.
Gracias, doctora Edna Howard, y muchas gracias a todos por asistir hoy. Y doctora Edna, hay más gente en el waiting room. Posiblemente. So, gracias por la oportunidad hoy. Y la verdad es que puedo hablar español para cenar y para bailar y para festejar. Es muy bueno español, pero para dar una clase es un poco más difícil, entonces voy a hablar en inglés, pero mis diapositivas son en español y inglés. Bueno, tú puedes leerlos y escuchar y puedo hablar lentamente y si tú tienes preguntas, por favor, cuando estoy hablando, pon tus preguntas en el chat y vamos a tener tiempo después la charla para preguntas y respuestas. Ok, bueno. Órale, estamos aquí en el sábado por la mañana. Bienvenidos a todos. Y hoy voy a hablar sobre modelos de sostenibilidad, sustainability in English, para comunidades saludables. Soy Rebecca Lee. ¿Y qué más? Solamente tecnología es poco nuevo para mí. Ok, soy yo. I'm a professor in the Center for Health Promotion and Disease Prevention at the Edson College of Nursing and Health Innovation. I wrote this book, Reversing the Obesogenic Environment. It was now 10 years ago, but it still is the only one. So there's that. I enjoy living in Mexico and practicing my Espanol. And if you like, you can email me at releephd@yahoo.com. Mándeme un correo electrónico. Y también I am also on the Twitter at Dr. Lee. And I do have Facebook and Instagram, but I don't check them because I'm too busy. So, okay. Oh, yeah. Follow me. Sígueme, ¿no? Posiblemente. Okay, so do we have the polls? ¿Recibiste, doctora, las polls, las preguntas? Ese es el primero momentito. Entonces, pueden pensar, estoy aprendiendo mucho en este curso. Muchísimo. Ok.
Yo espero que digan que algo. Y si no, voy a participar. Es importante aclararles que cuando son presentaciones en inglés y en español, recuerden que después de la sesión de la doctora Rebeca Lee, tenemos una sesión de resumen de cierre para cualquier situación y que mejoremos pues lo que queremos con nosotros captar y decir que sí, estamos aprendiendo más o nos estamos conflictuando más, pero eso es lo importante.
Hola, Dr. López y Taylor.
¿Cómo estás, Rebeca? Mucho gusto de verte.
Oh, el gusto es mío.
¿Todo
Todo
bien?
está bien.
Todo bien, igual. Aquí estamos. Muchas gracias por apoyarnos en el curso, Rebeca.
Oh, a placer.
Bien.
¿Cuánto tiempo tenemos para el poll? El aprendizaje.
Pues creo que ya, ¿no? Edna, no sé a dónde se fue Edna, pero
¿Puedo cerrar?
sí,
Oh, ok. Ah, oh, gracias, doctora Edna. Ok. Entonces, 77%. Sí, mucho. Y 22. Algo es mejor que nada, pero una persona, nada. Qué mala suerte. Pero gracias por, gracias por estar aquí, la persona que en realidad no. Ok. Oh, perdón. So, muy bien, muy bien. Ok, poco más. Ok. Maybe. Okay, so, ¿qué es sostenibilidad? What is sustainability? So I hope you can see my little sustainability smiley face chart that I like to use in cases like this. So sustainability, as maybe you can guess, it has to do with maintaining the original activities that you planned with your intervention study or program. And sometimes some of them are sustained, sometimes none of them are sustained, and sometimes everything is sustained. And then sometimes you also get what is called expansion. And expansion then is when you go beyond what you originally planned or proposed and do more. Maybe you go to additional sites. So maybe not solely the one clinic that you started your intervention program in, but maybe all the clinics in Jalisco or all the clinics in your country. And it is possible, as you can see from the smiley face chart, to have no sustainability and no expansion, or maybe what you proposed was not sustained, but something else came from it. So then you had expansion on the concept, but maybe a different application. Sometimes you have some things sustained, but not everything, but maybe some expansion. Or sometimes everything is sustained, all of your planning and programming is sustained, and you expand to other places and perhaps do additional things. Maybe you planned a physical activity program at a work site. And maybe also, in addition to the physical activity program, that went very well. And maybe then the cafeteria decided to introduce more fruit and vegetables. So you had an expansion to another behavior. So sustainability is really important because we work very hard when we are planning our programs and our intervention strategies. And we spend a lot of money on it. Often it is government money from taxpayers. So we want to make sure that we can sustain it. Or if it works, sustain it. If it doesn't work, we don't want to sustain it. We want to try something different. So, Dr. Edna, are we ready for another poll? We have another pregunta for you. What is sustainability? I'm hoping Dr. Edna está aquí. Here it is. Ta-da. Okay, ¿qué es la sustentabilidad? ¿Algo más que quiere votar? Solo 10 segundos. Rápido. Votar, votar, votar. Vota, vota, vota. Oh. Ok, no más. Okay. Okay, so looks like of those of you who voted, maybe about 75% voted. Yes, you got it correct. It's a strategy to improve and maintain the benefits of the investigation, of your intervention investigation. And one person said, no idea. I have no idea. I hope you will have an idea when we are done. Okay. Okay, so sustainability, when we have written a lot about it, my colleagues and I, really has 4 main constructs and also one additional construct that is very important. So The four constructs are replicability, institutionalization, continuation of benefits, community context and community capacity, and cost. And we can kind of talk more about these as we go along. I know you read these articles, so I won't go into too much detail. But replicability really has to do with how repeatable and complex your program or intervention is. So all of the little moving parts. Institutionalization has to do with how well you can integrate your program or intervention into the existing policies and other processes and priorities of the organization you're working with. So maybe a school, maybe a clinic, maybe a work site, maybe a community. Continuation of benefits is a concept that comes from the American insurance business, so healthcare, but it is the same for any kind of organization. So maintaining benefits for both the individuals, so does their health improve and can you keep them healthy over time, but also for the organization. Then community capacity and context really has to do with how supportive your community is and their willingness to provide resources or share resources, work with you to do your program, but also to maintain it over time. And then cost is very important because everybody's always worried about money in this time. And things that are more expensive than, if your program is more expensive than what currently exists, you have to show that you are having so much better results that it is worthwhile and worth the money to do your program in order to sustain it. Oh, there's English, in case you missed it. So replicability is how complex something is. So these slides are from the United States of America, and we had a very big change in our healthcare system during the Obama administration called the Affordable Care Act. And it's very complicated and it is different in every state. In the United States, we have 50 states and districts and provisional protectorates like Puerto Rico and other places. And the health insurance for people is different everywhere based on where you live. So it's very, very complicated. And I imagine from my understanding that this is true in many places. Healthcare can be quite complicated. And so the system of obtaining healthcare and the benefits from healthcare is hard. It is hard to repeat it consistently because it is very complex and it has many pieces and parts. This is just one example. You can see this in many kinds of settings, like schools or communities, other places. A little more about institutionalization. So this graphic kind of shows you a process of institutionalizing your intervention program into some existing structure that is already there. And institutionalization means that what you are doing then gets put already into the usual program. So there has to be a need for what you are offering. You have to introduce a strategy that will work, that is relatively easy to do, not too complicated, and try to integrate it in with an existing process. So for example, if you wanted to introduce maybe a program to help people get vaccinated against the coronavirus, maybe you could have their doctors who they already see for an annual visit, ask them, have you been vaccinated? We can give you the vaccine today. So that would help to institutionalize your vaccination program in with an already existing program. Doctors often will ask patients if they have been vaccinated against the flu, for example. So that is something that could be already integrated within an existing process. And then you have to have a strategy to implement this. And this is where having a funding source helps to stimulate uptake, or having developed very good partnerships that will help you to make sure that your strategy is implemented and then institutionalized. And in the process of institutionalizing something, you have to be working with your practice partners and have support from your community and have something that is replicable and cost efficient. So all of these constructs kind of tie together. Okay, so continuation of benefits. So continuation of benefits, then, these benefits that you are providing with your intervention program have to continue for both individuals as well as for the organization. If it is not a benefit to the organization, even if it is helping individuals, they won't keep it going for you. If it is too much of a cost burden, or if it is too hard, they will not be able to do that. And the continuation of benefits must continue after your initial programming time is over. So can be tricky. Okay, here we go. So community capacity and community context. So as I said before, this has to do with support from your community, but this is not just people saying, I support you, but also politicians being willing to say, yes, we want to support this. We want to allocate resources, dedicate money and support to this program. It is also community organizations, not-for-profit organizations, maybe, that also will support whatever your initiative, your intervention program is. As well as having existing policies and the people on the ground willing to do whatever you are suggesting for them. And then for cost, our fifth construct of sustainability. If your intervention program is expensive or more expensive than what is currently happening, it's harder to implement it. It's harder to sustain it. It's better if it's less expensive, so you can make a case. Everybody likes to save money. Everybody likes a bargain. Everybody likes to get more bang for the buck. That's what we say in English. I don't know if you've heard that expression. So if you are implementing a physical activity program that is very expensive to implement, and it is more expensive than what is currently happening, and very few people will do it, it's not going to be sustainable. Okay, oh, we have another pregunta. We're flying through the preguntas. Okay, is our poll ready? Poll is ready. Okay. Do you work with community or practice partners? Oh, this is very good. $50%. Oh, yeah. Keep it going, guys. Okay, come back to the computer now. It's time to vote. Esa pregunta muy fácil. Ok, solo 10 segundos para votar. ¿No más? Okay. Oh, we got one more in. Okay. Oh, perdón. So it looks like most of you are working with colleagues who are practice partners, like doctors, nurses, teachers, other providers of services, maybe physical therapists, maybe other kinds of people who are actually working directly with patients and with people providing services. So that's great. So you're going to like this. That's very important to have those compañeros de práctica. Maybe. Okay. So I want to tell you now about the Childhood Obesity Research Demonstration Project. And this paper, I put this paper in the Dropbox, Dr. Edna. So it's in there along with other papers that are in this talk and papers from the last talk. So you can get that easily. And this paper describes the whole Childhood Obesity Research Demonstration Project. We call it CHORD. And this was a very large and painful project to do to stop childhood obesity. We tested an integrated strategy to implement multi-level, multi-sector environmental systems and policy changes to reduce childhood obesity. So it's very big. It was in 3 states of the United States, and I will show you where in one moment. And it was very complicated. We linked different settings, school settings, clinic settings, and community settings by using community health workers, promotores, as I think we say in Espanol. Oh, ¿qué pasó? Okay, here we go. So this is a complicated schematic. This graph or this figure is also in the article. So you can pull up the article and look at it more closely on your own time. But you can see that we had inputs from primary health care, and we had inputs from community organizations. We had a very good partnership with Parks and Recreation. It's very important for helping people have places to be active. We had partnerships with early care and education. Preschool, I think maybe is the old word. In the US now we use the word early care and education. things change. Also public schools and family home environments. And at each of these settings, you can see that we involved many stakeholders. So the providers of the services, but also administration and staff, and at the home environment, families, parents, and children. And we were trying to show that by using inputs across many settings, we would have a more sustainable and robust effect on improving child health outcomes, reducing childhood overweight and obesity. We have a big problem with that in the United States of America. And also improving quality of life and sustaining this programming in these sites so that after our study was done, it would keep going. Okay, so here, this is a map of the United States of America. You may have seen it. These are only the continental United States. Also, Alaska is way up on the upper left side of your screen, and Hawaii is way out in the Pacific Ocean, but we didn't have any sites in Alaska or Hawaii, so I did not include them. But you can see where our sites are in California. We had 3 cities in California, Southern California, very, very hot and very close to the border with Mexico. Then we had 2 sites in Texas, Austin and Houston, which is where we were based in Houston. And then we had 3 sites in Massachusetts, which is up there in the upper right-hand corner. And most of these sites had a very heavy Hispanic or Latino population. So most of our kids and families were Hispanic or Latino, most of them Mexican American because of the proximity to the US-Mexico border. Although I think we had people from other Latino countries in Massachusetts. So you can see these are 3 different states, very far apart, very different places. Massachusetts is very progressive, very supportive of public policies. California also supportive of public policies. Texas not supportive of public policies, very conservative, different political systems. And very different healthcare systems. I told you earlier that in the US, we have a very complicated healthcare system that is different in every state. So depending upon where you live, you receive different healthcare. Education is also determined at the state level. So educational priorities are very different. So it was very hard to figure out how we would have sustainability that we could systematically evaluate across all of these sites in different states. So we published this paper to describe our sustainability evaluation model and process, which is still ongoing, even though this study was over maybe, I don't know, at least 5 years ago. Oh, we have a poll. Very excited. Oh, this is a do you remember my last lecture question? Very excited. Okay, what are the levels of the ecologic model of physical activity from Spence and Lee? Okay, got a bunch of smarty pants who were listening to the lecture, I see. Yeah, smarty pants en español es pantalones inteligentes. Y una persona que es pantalones inteligentes, muy inteligentes, smarty pants. Okay. Oh, still going. Algo más personas que quiere votar. 10 segundos. ¿Segundos? ¿Es la palabra correcta? Ay.
10 segundos en mexicano son como 30 segundos más.
Tiempo es un constructo. Oh, 70%. Una más. Una más. No, no más. Ok. 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 La respuesta correcta es micro, meso, exo, macro, pero es poco confundido porque comunidad es muy importante, entonces poco complicado. Y posiblemente necesitamos leer el artículo otra vez. Es en el Dropbox. Ok, muy bien. Ok. ¿Qué pasó? Tecnología. So, when you are thinking about planning for sustainability, you must use a guiding framework, theory, or model. It's really important. So here is another version of the ecologic model of physical activity, but we adapted it for obesity. And you may or may not remember that we had macro level environment, micro level environment, the meso exo level environments, forces of change, and then individual level mediators, pardon me, that then all of these things work together to help people maintain a healthy weight. And I think this is also in the Dropbox, so you can take a look at it and read it at your convenience. So this is what we used. We used this model to frame what we were going to measure to think about sustainability. Oh, there's English. Okay, all right. So this table is also in the manuscript. So you can look at it. It's in the Dropbox. But what I would like to draw your attention to is here are our models of our levels of our model, our levels of our model. So we have all of those. And then here are our sustainability constructs. So we made a very simple chart like this to determine how to measure replicability, continuation of benefits, institutionalization, and community capacity across all of those 8 sites in 3 states. Very complicated, right? And we used checklists. I'm sorry, I can't remember the word for checklist. It's encuesta. I don't know. Dr. Edson, what's a checklist in Espanol? I don't know. We will find out later. So we used checklists. We used electronic health records. We used in-depth interviews, entrevistas. We used our community health worker data. All of our community health workers had little tablets like this, but bigger. And they put information in. Oh, hold on, what happened? We also did different kinds of surveys. We conducted a lot of data collection and collected all of this information. We are still analyzing it. Today, I will talk a little bit about some of it, but you have to wait till next time for more of it. Okay. Very good. Okay, so when we are planning to have sustainability, it has to start at the beginning, right? At the planning stages. And you have to make sure you have a really good way to think about defining what you are going to measure and how you're going to measure it. You have to have a communication plan, not just between or among the investigators, but also with your practice partners, your doctors and nurses and teachers and other community organizations. How are you going to communicate? Because communication is really important for the success of your study. You have to have realistic expectations, and you have to plan for a lot of people to help you do the research if you are collecting data. Lots of people. Then, before you finish your planning, then you implement your intervention program. And you have to remember that you must be very flexible. When you are planning with your operational definitions, make those really clear, then it becomes easier to be able to measure your constructs. Maybe one site does an encuesta, one site does an entrevista, and then you are able to harmonize these measures. And it's complicated, but flexibility is important, but you still have to maintain scientific rigor and understand that every time you implement a research study, your sites, if you are working with sites, they will have competing priorities. Always it is very hard. And again, labor, lots of labor. Then when you go to analyze these data, I told you about data harmonization. That takes a long time and it can be very difficult, which is why when you were planning, you wanted really strong operational definitions. And you have to verify, cross-check. It is good to have multiple measures of constructs. So that you're able to make recommendations to improve your program so that it continue to be sustained or it can continue to expand. Let's see. Oh, it's in English. No, it's not in English. That's in Espanol. That's in English. Okay, here we go. So this table 2 is also in the Lee et al. Article that is in your Dropbox. Okay, so we wrote a paper about this plan and we wrote it after we had done the study. So these were our lessons learned. We faced many challenges. It was very hard. We had many other people involved and it took a lot of time. So you remember I told you that planning is very important because planning, what you plan and then what happens in your study may be very different. It's very hard. So you have to be prepared for that. And I told you about competing priorities, always an issue. Having flexibility of measures, I told you about that. Having a plan for communication is really, really important. We found that if we could use publicly available data sets, that was very helpful because that meant that our sites did not have to collect that data. So it's easier. It's also very labor intensive. You need a lot of money to pay for a lot of staff to do this. It's very hard. So then I think this is the last paper I'm going to just share with you today. So this is a paper that talks about, we did interviews, entrevistas, with our investigadores and our implementers and investigators. This article is also in your Dropbox. And this describes what we found. We found 4 themes. I think I have this in Espanol. Yes, you have to have partnerships across multiple levels. And the partnerships then have to rely on evidence-based practice that is very important for the providers. You have to keep the communication going, and you have to continue to circle around it. It is called an iterative process. You talk to your provider, they tell you this doesn't work. So then you have to change that while you're going along on the fly, as we say in English. Each of the partners, you have to recognize that everyone has an important and unique role, but all must be complementary. And providers have to realize that they are the role models for who they are intervening with. So if you are asking your doctors to recommend physical activity, like in exercise is medicine, for example, the doctors have to realize that they are role models and they must be exercisers also. They are seen as role models. This is very important. Yes. Okay. So we also found from our investigators and implementers that there were many challenges to sustainability that they found. The first one I think I talked about before is money. Funding is very important. Sometimes they were not able to form the right kind of partnerships. You have to be very careful and strategic with who you partner. Sometimes institutions did not have the capacity to implement the changes we recommended for our intervention. Maybe schools did not have equipment or machines to be active on. Things are always changing. You have to be able to prioritize and reprioritize what you need to do to make sure that you meet the goals of your study, but also then have sustainable change. Okay. So another thing that our investigators and implementers recognized was that you have to have buy-in from multiple settings. So you have to have the buy-in from the clinic and from the school and from the community, otherwise it won't be sustainable. Each site has to have a champion. I don't know if you have that same kind of experience in other countries, but someone at the site who will make sure that things are happening. So I have maybe 10 years of, maybe more, of studies implementing gardens in preschools, early care and education sites. And the garden helps kids to be more active and eat more healthfully. I think I told you about it last time, maybe SAGE. That will not work unless there is a champion on site, a teacher or teacher's aide who wants to make sure the garden will work. So that's very important. And there's many examples of this. It's important to have good relationships between sites so that they can share experiences and help to make sure that there's a consistent message. And these messages have to be transmitted or conducted also in the home environment. So having our community health workers really helped with this, our promotoras. So then the last theme that we identified was really having continuous engagement and continuing to keep our relationship very strong with our partners. We had to continue to take the feedback from our partners and use it to make sure that our projects were strong and continued to work so that they would be able to be institutionalized and continue to provide benefits to the institutions and to our children and families. Okay. Oh, Teotihuacan, look at that. Last weekend, I took a short vacation to la Ciudad de México y tuve un globo aerostático sobre Teotihuacan. Wow. You should do that when you can on your next vacation. Very interesting. Okay. So let's see here. I think I told you these things, so we'll go through these quickly because I think we're almost out of time. But just to make sure that you recognize the strengths of your partners and that they are going to be different than yours, and people are going to have different priorities than you do in your practice partners. And recognizing these and leveraging them is helpful to make sure your project is sustainable. Establish goals that are achievable, but make sure your goals are the same as your partner's goals. Same goals as the clinic, as the school, as the home for parents. So it's a lot. There's a lot of moving parts. Shared goals really helps to make sure you have a sustainable strategy. So when you are planning, you have to think very carefully about what your milestones are going to be. How will you measure success, but also when will you measure success? And then when you hit your milestones, how do you communicate with your partners that things are going well? Make sure you have a plan for that so that they then will be able to say, look, this is working and we are staying on budget, and look at all the people we are helping. And if it's not working, you have to revise and figure out a way to make it work. Yes. You have to make sure that not only can you generate partners, find new partners, but also that you can sustain these partnerships. And you have to work at this as though these people are your greatest treasure. Very important. This may be it. Yeah. So lots of communication. You as the investigator are communicating with your sites, but also your providers must communicate with you, and you have to listen to each other and make sure that it works. And sites must communicate among each other as well. So communication plan is very important. Okay. Money makes everyone happy. So if you can do this where you are, develop a relationship with your funding agency. Find your contact person in your funding agency and meet them when you are where they are. When you go to the capital city where their agency is, ask them to have a cup of coffee and talk with them, because you have to have a relationship with these people so you know what the funding priorities are, so you can respond to that, because nothing happens without money. You know, in the United States, we say that science is a business. Science is a business because we can't do science unless we have money, because you have to pay for people and you have to pay for supplies and equipment, and having money makes that all happen. And I think that's true in many places. So, you know, be aggressive, be persistent, but always be smiling. Make friends, very important. Have a backup plan. Oh, okay, there we go. Everything always is changing. Priorities, collaborators. In the fall of 2020, I lost a collaborator, a good colleague that I did many research studies with, and she died. And it was very upsetting because it took me a long time to figure out how to move forward without her. So things always change. Make sure you have backup plans and other colleagues too that will help you. Nothing is forever. Let me see if I can get this. Yes, when you go to meet with your partners, let me just, there we go. When you go to meet with your partners, make sure that you are your authentic self and not anybody else, because you want to make sure that you develop a relationship that is built on trust, so that your practice partners will tell you what you need to know and will be honest with you, so that you can have sustainable health improvement. And if you do not have this, then you're not going to succeed. It's going to be very hard. Okay, so also, I think this is the last lesson. My goodness. Let others have a chance. I think it's really important to share the science. I know I told you science is a business. It's true, but it's different kind of business in that you have to really help others have an opportunity to work with you, because it's all about the relationships you build. Sustainability is about relationships, building relationships so that the priorities of your science and interventions can become the priorities of funding agencies. They can become the priorities of community sites, of clinics, of schools. The priority of the health of the public has to become everyone's priority. So give others opportunities so that they can also embrace this idea. And then you can, great success. Okay, I think these are the conclusions. Be courageous, be persistent. There's a Chinese expression that says, maybe I told you this last time, the dragon and the phoenix are an auspicious pair. The dragon and the phoenix make an auspicious pair. Courage and persistence are key. Your colleagues, your collaborators are treasures. You know, try to have the highest quality people, get to know the best that you can. Plan in case there's going to be all kinds of things that happen. Who knows? You may be doing your science at schools and suddenly there is a pandemic and you can't do your study anymore. So you have to be ready with other opportunities and other ideas. So keep thinking about those and other ways to work around challenges. I think, yeah, last point, mind the capacity. Make sure that you are very clear on what is realistically possible with both your science, but also your partner's ability to do what you ask them to do, so that you will be able to have sustainability in your programming. And if you exceed what is their capacity, rather than working within to institutionalize what you are hoping to change, you will not have success. It will be very hard. Okay, I think that is it. Preguntas and questions. Oh, this is me. Here I am. Thank you.
Gracias.
I'm gonna change this slide right now. I'm gonna edit on the fly. Hold on, here we go. There we go. So you've got that there. Okay, ta-da. Now you know my Twitter feed. Some of you followed me after last class. Thank you. I tried to follow you back, but if I miss it, just send me a message and then I'll follow you back.
Okay, ese es tu Twitter, okay?
It's on Twitter, that's correct.
Perfecto.
Okay, I see there are hands raised. Do you want me to stop sharing? Or what would you prefer?
Por favor, si if you want to stop sharing, si podemos. Okay, thank you.
Okay.
Oh.
Hold on. There we go.
Okay. Bueno, déjenme explicarles cómo va a estar la mecánica. Ahorita vamos a abrir preguntas y respuestas para que todos participen, y recordemos que vamos a hacer un cierre, vamos a final por atención a que a veces, aún teniendo las diapositivas en inglés, el inglés todavía está pues no tan maduro, no estamos tan seguros. Siempre presento un resumen, si tú me lo permites, Rebeca, siempre hago un resumen al final de cierre de lo que tú dijiste, del tema tan importante que es sustentabilidad, para que no se nos vayan a ir, porque vamos a hacer un cierre, y obviamente también en el cierre, por nuestros tiempos que tenemos y nuestro objetivo de este taller, vamos a abordar nuevamente dos proyectos, dos modelos lógicos, y analizarlos para irlos revisando aleatoriamente, a ver a quién le tocó el día de hoy. Ok, entonces, sin más preámbulos, please be free to make your questions. Siéntanse libres de hacer sus preguntas a la doctora Rebeca Lee sobre este tema tan importante, y que me encantó que lo terminó filosóficamente, de ten coraje y sé persistente. Yo creo que eso, las conductas de cómo nos manejemos, es lo que nos va a dar sustentabilidad. Y después platicaremos de ese ejemplo del Dragon and Phoenix, que efectivamente aplica muy bien en sustentabilidad. Sean dragones, sean fénix, para que puedan lograr esto. Pero sin más preámbulos, por favor, les dejo abierto el micrófono. Ustedes son libres del micrófono, ábranlo para hacerle preguntas en relación a este aspecto que la doctora Rebeca Lee tiene mucha experiencia. Yo sí quisiera, ¿aprovecho mi micrófono o les dejo abierto? Porque yo sí tengo una pregunta para la doctora Rebeca Lee. ¿Cuáles son los obstáculos más frecuentes relacionándose con stakeholders, con el mismo gobierno, con políticas, que tú te encuentras cuando quieres evaluar y aplicar esta sustentabilidad?
Oh, I think it's relationships.
Okay.
Relationships.
Okay.
It's the
Relationship.
big relationships. People have to, you have to have really strong relationships. It's not what you know, it's who you know. So
Oh,
yeah, so who you know helps you to get the funding. It helps you to have good community partnerships. It helps you be able to try innovative strategies. It's, you have to have connections in these places and with people. So partnerships probably is the most important thing. And so, you know, everyone here is really smart, right? And it's not enough. You have to be really smart and you have to have the relationships and you have to be able to have some way to persuade your partners that your ideas are good ones. So you have to persuade the funding agency, you have to persuade the clinic, you have to persuade the school. So community. So it's all about relationships. And so even if you just have one good collaborator at one site, if that is the right person, the good partnership with the right person, it can make magic happen. Relationships are the most important thing. We are human. That's what we do. We do relationships.
ok. Rebeca, con esto, y yo creo a toda la audiencia que tenemos aquí, pues, ¿qué quiero decirles? Que las sesiones previas, puedo saber mucho, pero lo más importante es, como dijiste, who you know, a quien conoces es más importante que lo que yo sé. Entonces, jóvenes, aquellos que estaban preocupados, si no aprendí mucho en este curso, esta plática te está diciendo qué es lo importante y lo demás se vendrá en consecuencia. Pero si no, aunque sepamos mucho, si no sabemos y no tenemos la relación en nuestros programas de intervención de saberlos con quién hacerlos y que esa persona te apoye para hacerlo, aunque sepa muchísimo, esto no va a funcionar. Entonces, es algo, Rebeca, que nadie nos dice. Nadie nos dice, nosotros diseñamos programas de intervención maravillosos, pero no tenemos el contacto, la persona que tenemos en contacto no nos apoya, no tiene ese potencial, ese poder de poderlo hacer. Entonces tenemos que pensar que a la mano que diseñemos un programa maravilloso, tengamos a la persona maravillosa que nos haga, como dijiste tú, magia, y las cosas van a suceder. Es una realidad y creo que esta plática nos hace ver de una manera científica que finalmente sí sabemos que el tener los colaboradores, como lo dijiste tú, es un tesoro. Entonces, podemos resumir que la sustentabilidad está basada en los colaboradores, ¿verdad, Rebeca? Y eso lo que nos da la continuidad y ser persistente y persistente de manera, me llamó mucho la atención, amable. Y sí, ¿cierto? No nos ganamos nada peleando ni enojándonos. Bueno, sí, nos podemos enojar acá afuera y luego así, ok, podemos sobrevivir. Entonces, perdón que lo haga tan dramático, pero es la realidad. No vamos a perder ni nuestra dignidad ni nada de eso, sino que simple y sencillamente hay gentes que somos diferentes, las gentes son diferentes y tenemos que aceptar esa situación. Ahora sí, me voy a callar porque me gustaría escuchar los comentarios y preguntas de los participantes, porque tenemos a gente que trabaja y que se ha topado con dificultades y situaciones que sí nos gustaría que nos compartieran. por favor.
Hi,
Espérame.
good morning. I have a question.
Okay.
My name is Tania Briceño. I could try to speak in English, but I'd rather be in Spanish. So I hope doesn't be a problem.
Habla
Te apoyamos,
despacio. Habla despacio.
Okay.
Te
Okay.
apoyamos, Tania, ¿eh? No te preocupes.
Cuando yo me he fijado que cuando se hacen intervenciones, generalmente luego, sobre todo en clínicas, que es donde yo he trabajado, mi intervención va para una escuela, pero creo que es el mismo caso. A veces hacen una sesión informativa al principio de la intervención, en ocasiones, donde invitan al personal y les platican qué va a pasar. Y ya luego no pasa nada, o sea, luego ya no hay más información conforme durante la intervención, sino hasta el final, cuando ya van a dar los resultados, y eso a veces ni siquiera los presentan en los lugares donde se hicieron las intervenciones, ya solo se hacen las publicaciones. Y en lugares como los hospitales o las escuelas donde hay mucha gente involucrada, pero no implicada, porque luego a veces ni se enteran qué está ocurriendo. Mi pregunta es, durante la planificación, porque yo nunca lo he visto, pues no sé si es incorrecto hacerlo, como tener una constante comunicación de lo que está ocurriendo, no sé, carteles. Se está haciendo esto, se está trabajando en esto, o esto de estar haciendo una constante divulgación del programa de intervención durante la intervención. Yo pienso que eso implicaría más a la sociedad y a actores, como lo menciona usted, padres de familia, que a veces no se implican, pero porque ni los conocen los programas, ni saben que se están aplicando. Entonces, ¿cómo te pueden apoyar si ni sabe qué está pasando, no? Entonces, esa es mi pregunta, que ¿por qué esto no ocurre en las intervenciones? ¿Por qué no es un paso importante? ¿O por qué nunca se menciona estar en la divulgación de lo que se está haciendo?
Mucho. So there are many things, right? So you are asking, why is this not important? Otra vez en tu pregunta, más corto.
Okay. ¿Por qué? ¿Por qué no es, ¿por qué no es parte de la planificación de una intervención la constante divulgación durante la implementación del programa? Para que todas las personas estén, o sea, conozcan lo que se está haciendo, el trabajo durante la intervención.
So you are asking why in the planning we are not able to plan for what actually happens during the intervention?
But more like
it's about the diffusion of the program
And communication.
It's about communicate to the community what is going through during the intervention. So maybe not talk to all people, maybe to cartels or a web page, or I don't know.
So I think that you can plan to communicate at the beginning and have an idea, like, yeah, it could be a cartel in the clinic or at the school or wherever, or it could be information on the internet or whatever. And I think it is very tricky to find a balance between scientific rigor and sustainability, because for sustainability, you have to be communicating all the time with your community, with your implementers, with your investigators, your practice partners. And so it is helpful if you have a strategy that you believe has already been tested and has worked under very well controlled conditions, so that then, yes, while you're doing your sustainability research, you are able to take your intervention and tell your community about it. However you decide to do that. Is that correct? Yeah, Dr. Reda?
I will translate it because the audience in Spanish. Is that correct? Is that okay? Tania,
Sí.
Rebecca? Ok.
Ayúdame.
Preguntaban que por qué, Tania, Cristina Briceño preguntaba por qué no incluimos la diseminación y la comunicación de los resultados o acciones realizadas. Ese es el punto. Y ahorita comenta la doctora. Sí.
No, es que ese precisamente es el problema. Creo que solo se publican. Cuando están en un hospital, en una escuela, solo se informa al principio y se comunican los resultados. Pero luego, en estos lugares donde mucha gente entra y sale, que luego no se enteran qué está ocurriendo, digo, ¿por qué no durante la intervención que la gente sepa lo que está ocurriendo para que pueda implicarse? Creo que eso es algo que no se hace.
Así es, Tania. De hecho, tú, Tania, más que estás preguntando, te estoy escuchando muy bien, que estás proponiendo algo que no se fijan muchas personas, y lo comentó la doctora Rebeca Lee. Que existe un proceso que se llama evaluación de proceso, si recuerdas. En la evaluación de proceso, ahí deberíamos de incluir, y siempre pensamos en los resultados. No, en comunicar sobre las acciones que se están haciendo a la comunidad, lo comentó ahorita la doctora. Nos falta eso, siempre pensamos en informar a los investigadores, al gobierno como política o como acción, pero no hacemos una comunicación trans durante todo el proceso y desde el inicio, incluyendo a la comunidad, para la comunidad. Qué curioso, trabajamos con la comunidad, como tú bien comentas, y no les comunicamos. Entonces, más que un comentario, yo lo veo, Tania, como una propuesta muy correcta que se debe de considerar la comunicación, se llama diseminación de la información en la comunidad, a través de lo que tú dices, carteles, o que los mismos directivos mencionaran. Estoy pensando, soy de clínica, pero estoy imaginándome en las sesiones de cada mes de los médicos, oigan, decirles, fíjense que estamos haciendo esto, vamos en esto. Los carteles funcionan mucho en las clínicas cuando ponemos los pasos. La gente, como tiene mucho tiempo esperando, tiene tiempo para visualizar qué es lo que está pasando. Entonces, al contrario, Tania, te agradecemos, y la doctora Rebeca Lee lo comenta muy bien cuando ella dice, es darle la información a la comunidad. Aquí el arte viene y lo comenta desde el inicio, no se planea, siempre pensamos en resultados post, nunca pensamos en acciones, como no tenemos resultados intermedios, pues no presentamos nada, pero no estamos mencionando lo que estamos haciendo, y ellos son parte de una acción. Entonces, la doctora Reddy enfatizo lo que ella contesta, que sí, hay que comunicarlo a la comunidad. Yo creo que si estaba revisando el artículo de Children, I will going to talk about your preschool study, el artículo que les puse ahorita en el chat. Ahí, por ejemplo, muestra carteles, y si te fijas, los panfletos van dirigidos a la comunidad. Entonces, asumo que estuvieron haciendo una serie de carteles informando a los padres de familia, informando a los directivos de las escuelas, de todos los procesos a través de carteles. Entonces, creo que, conclusión, con lo que tú comentas, debe de incluirse debe incluirse esta parte de comunicación. Entonces, ya vamos a agregar, we're going to add to our implementation programs, Rebecca Lee, the aspect of communication. Well done, communication. We have to do a very good communication with the program.
Yes,
Tania?
and that has to be,
yes, Rebecca.
That you have to plan that in from the beginning and have staff who are dedicated to that, and you have to have money that you are going to support that with, to do your webpage, to make your whatever, newsletters, flyers, carteles, whatever. So it's, yes, communication, muy importante, durante todo el proceso.
Ok,
Gracias.
Tania, ¿está correcto, Tania? Ahí.
Gracias, Tania.
Gracias, Tania, muy bien. ¿Alguien más? Que más que también preguntas, ¿puede hacer contribuciones como Tania lo acaba de hacer ahorita? Preguntas, comentarios. ¿Alguien más? Si no, alguien. Si no, para pasar al resumen, si me lo permites, Rebeca, y es importante que estés presente porque tengo aquí a la experta y no, I don't want to say anything wrong.
No.
Okay.
I'm sure it's correct.
En resumen, se habló del día de hoy de sustentabilidad y lo puse en el término que a mí me parece correcto, pero estamos abiertos a que lo definan o lo expresen como ustedes deseen. Y pongo una palabra muy importante aquí que es trabajo de equipo, como mencionó la doctora Rebeca Lee. Cuando hablemos de sustentabilidad, recordar la importancia de la visión del modelo ecológico, tener esta visión de los niveles macro, meso y exo. ¿Por qué? Porque esto nos va a dar explicación de las asociaciones. Siempre tenemos que hablar no solamente de las actividades o estrategias que hacemos, sino de las influencias que pueden existir y que todo esto se repercute en lo que nosotros estamos queriendo incidir, que en este caso, por ejemplo, es en relación a actividad física. Pero aquí la clave del modelo ecológico nos va a dar toda esta relación de influencias. Y aquí ponemos en el nivel de meso, donde se trabaja más es en el área de micro, con las personas. Aquí nada más para mostrarles un ejemplo que hicimos, Rebeca. I will show you explain an example or try to review sustainability. Aquí quisimos ver la sustentabilidad de un programa que se llama Módulos de Bienestar Familiar, en donde, por ejemplo, al final queríamos tener todo un proceso de manual de procedimiento, pero para implementarlo y ver el mantenimiento tuvimos que ver procesos desde administración, la aplicación, la capacitación, el marco de mercadotecnia, donde entra la comunicación y la vinculación, que es muy importante. En otras palabras, la participación de los diferentes actores. En resumen, tomando todos los comentarios de la doctora Rebeca Lee, podemos considerar la sustentabilidad cuando se trabaje en la comunidad. No se puede olvidar, si se va a trabajar en comunidad, pensemos sustentabilidad. Recordar los pasos de planificación, de implementación y análisis que son fundamentales en esta sustentabilidad. Considerar el modelo ecológico, el cual sirve para explicar los factores y las influencias. Tomar en cuenta, como bien dijo ella, a todos los que influyen. Aquí la palabra me equivoqué un poquito porque influencers se va a tomar siempre, ya no la ganó la red, los dispositivos, pero también podemos tener influencers en nuestra comunidad que tenemos que checar y a los proveedores en su programa. O sea, todos en mayor o menor grado. Y como también bien dijo, sustentabilidad está basada en relaciones. Las relaciones que tienen que ser buenas, amables. Y la comunicación es muy importante con un método establecido. Tiene que haber un proceso definido de cómo voy a hacer esta comunicación, que yo creo que es lo que nos da la veracidad y la consistencia, y de evitar la espontaneidad que a veces nos complica y no nos deja definir o ser claros en cómo lo hicimos para haber logrado lo que logramos. Y Rebeca, si tú me lo permites, termina Rebeca con este punto que se me hace muy importante. Nada pasa sin dinero. En cuestiones de sustentabilidad hay que ser realistas, que la ciencia es un negocio, y no se entienda mal en la palabra negocio. ¿Qué es lo que queremos nosotros vender? Salud. ¿Qué es lo que nosotros queremos vender? Que la gente sea más activa, que coma mejor, que esté mejor emocionalmente, mentalmente. Entonces, pues si para eso tengo que conseguir dinero, hay que verlo. Y pues me hubiera gustado poner la última frase, pero la voy a decir. It's more important who you know than
What you know.
What you know. Es más importante a quién conoces que lo que tú sabes. Entonces, eso puede doler, pero es una realidad que no debemos de perder. Entonces, si tienen alguna otra pregunta o comentario, es el tiempo de decirlo. Thanks, Rebecca, to allow me to make an abstract of your talk.
Very helpful. Thank you.
Entonces cierro esto y sin más, si no hay preguntas, comentarios en el chat. Metodológicamente es importante planearlo desde el principio. Ok. Tania, sí, muy activa Tania. Sí, gracias Tania. ¿Alguien más que tenga algún comentario, pregunta? Yo espero que haya sido claro el tema. Y pues sin más, ahora sí, nos vamos a ir un poquito más temprano. ¿Dudas o preguntas? Para despedir a la doctora Rebeca Lee y agradecerle su participación. Yo agradezco mucho que siempre no se guarda la información, comparte. Hay que compartir lo que sabemos, hay que compartir lo que somos, porque si no, ¿para qué estamos aquí? Porque mañana posiblemente no podemos estar. Entonces hay que dejar, yo le llamo esa semillita, como le llamaron en Colima, el semillero, esa palabra correcta, hay que ser semillero de lo que vendrá subsecuentemente. Entonces, muchísimas gracias a todos. Thanks to everybody. Obrigado. Y nos veríamos entonces, porque ya se nos hicieron las 10:30, se nos hizo un poquito tarde. No, bien, todos vamos muy bien. Y estaremos entonces en contacto para el próximo sábado. ¿Ok? Gracias, Rebeca. Thank you very much. Un abrazo y tendremos oportunidad de compartir después de que todos estemos vacunados.
Gracias a todos por todo. Es una buena oportunidad. Muchas gracias.
Sí, así es. Muchas gracias. Muchas cosas no están en los libros, sino que aquí las vamos a poder ver en persona. Muchas gracias a todos.
Gracias. Ok,
Bye.
Bye.
Bye.